I have Dr. Lynn Westfall, who's our Chief Medical Officer. We're excited to have another day full of conversation. Yesterday, we really focused on fertility preservation, and that should be up on our YouTube channel. If it's not up now, I'm sure by the end of the day, it will be up. So feel free to refer back to that. We'll touch on it a little bit today, but we're really gonna kind of go like what happens now? Like after you've frozen your eggs, you've frozen your embryos, and kind of that path to parenthood. And we're super excited to have you with us. Welcome, everyone. We'll have our chat open, and chat is really there for you to put any of your questions, either for any of the panelists who are going to speak today or for Dr. Westfall, and we'll do our very best to answer everything. But just so you know, if we don't get to your question today, you are more than welcome to email us at navigator@kindbody.com, and we will make sure that we answer your questions in that way. And we're going to get started. We're going to just wait a couple more minutes to get everyone a chance to log in. So grab yourself a glass of water, whatever you need, a beverage, because we're very, very happy to have you here to have a very intimate and honest conversation about fertility, the journey, both from a medical perspective and a perspective of women and couples who have gone through it. I'm really excited. I have my partner in crime is Whitney Mixter, who is here with us today. Did she make it? Is she back in? Whitney, do I have you? Let's see, she may or may not. She was having computer issues. We all know about technology issues, that's for sure. And so we'll figure that part out. But again, Dr. Westfall's at our, oh wait, I have a let's see. Yeah, sorry guys. Okay, bringing Whitney back in just a moment. And then, but just give us a moment, we'll get started. And if there's any questions you want to start, also please drop in the chat where you're from, because it's really, really nice to feel apart but be together by knowing where everyone's from. Because to be honest, we love doing these events in person. So this has been our next best thing due to COVID to be able to have these discussions. But in a way, we've really enjoyed that because we found that we can connect with people from around the world this way. So again, welcome, welcome everybody. We'll get started in just a few minutes. Okay, Whitney, I found you. I see you there.
Here. Sorry about that. Technical difficulty.
Yes.
Right at the 11th hour.
Yes.
Glad to be here, everybody. Hello.
So Whitney, as we're waiting for people to come, do you want to talk a little bit about what brought you to Kindbody? Something that was said yesterday, and you and I kind of, when we spoke this morning, is so important, is in earnest, Kindbody was really built for patients by patients. And from our CEO to our president to myself, to Emmy, who we're going to speak to shortly, she is our clinic director in San Francisco, we've all been through this process. And we've had our ups and downs, and we really came together. And this is a female-founded company. We wanted to really change the way we look at fertility, the way we look at healthcare, and really completely flip the experience. And it should be something that's inclusive and welcoming. And if you see the picture that you see right now is one of our clinics, we don't want it to feel like this sterile environment. We want you to feel comfortable and welcome in every aspect that we do. And Whitney, as a patient, can kind of tell you from her perspective, because I can tell you all day how great we are, but I think that's why we really have our patients here to speak on kind of their experiences.
Yeah, you know, I just want to say, as you just kind of touched on, this journey isn't a linear one. You know, there's not one way to do things. And it's just really about gaining as much information and as much knowledge as you can about your options, and then making the decision that's best for you. For me, when I turned 37, I made the decision that regardless of circumstances, I was going to be pursuing parenthood in my 37th year. I had never approached this journey before as a queer woman. I was fairly certain it was never going to happen organically. And so, you know, I didn't know where I even stood with things. I also thought I had a very solid grasp of fertility and conception and things of that nature, which turns out I really didn't. There's a lot of information that we don't learn about our own bodies and about fertility as a whole as women. And so when I made that decision, it was just about taking that first step, just simply deciding and having enough faith in myself that whatever means it took to get there, I was going to start on that journey. When I found Kindbody, it was just so aligning for me because as Tracy said, you know, they are women founded and ran, and just walking into the office, I just felt really at home. It's a beautiful office. First of all, I would go to the Santa Monica location, and looking over a beautiful oceanscape while you're getting an IUI done is no bad way to do it. Let's put it that way. But, you know, I'm just incredibly grateful that I started this journey. I didn't let anything stop me. And it was incredibly empowering. You know, it's definitely been ups and downs, and we'll go through that later with our own personal accounts of things. But, you know, taking the information that was able to be provided to me from Kindbody just made me feel very empowered in my own journey with things. And now I'm so pregnant. I'm 8 months pregnant. So things are going well.
Absolutely. And I couldn't be happier to work on these events with you. And when it brought me, I get very weepy and emotional. I'm definitely the one that cries if I'm happy, sad, angry, frustrated. That's I guess my love language is tears. That's embarrassing to say. But when we're looking in the chat and someone had posted that because of your message and because of your sharing, that they actually realized that parenthood as a single person was approachable and doable. And that's why we do what we do. And the women that are sharing their stories, we're not paying them to share their stories. It's really because once you go through this, it's almost like you realize, like, why are there secrets? Why are there things? Why is it taboo to talk about it? So I really appreciate this conversation, and I appreciate everyone that's here to attend, because I hope whatever glean of knowledge that you also spread it, and we just go further and further, because there should be no shame. We should really be open to having this conversation. So to kick that off, thank every single person that's here today participating and attending. We really appreciate that you joined us today. I'm going to start off. I'm going to be selfish and introduce Emmy. Emmy is my clinical director in San Francisco. And I don't get to work with her every day right now because she's on maternity leave, because she just had her baby. But I'd like to introduce her, and then we'll go around and just kind of give a couple minutes and talk about each person. Emmy.
Sure. So I had my baby Mila on June 30th. It was a 5-year journey. My husband and I, we were friends since 2002. We ended up dating in 2015. And right off the bat, we already knew we wanted to have babies, and we knew we were going to get married and all that. So, you know, we started trying. And 2016, we got pregnant naturally. We were over the moon. We were so happy. Our families were so happy. And then I think it was 3 days before my 12th week, I found out that I miscarried. It was devastating. It always brings me to tears to talk about it. But, you know, we picked up the pieces and we decided to try again. Tried for another 6 months. We couldn't get pregnant naturally. So we said, okay, let's move on to, fertility treatments. Did 3 rounds of IUI, didn't work. So we were like, okay, let's take a little bit more aggressive measures. So we said, okay, let's move on to IVF. Did our first round of IVF. We got 2 embryos that round, transferred both, didn't work. Then I switched doctors because I didn't really love my first doctor. This was in Hawaii, which is my hometown. Switched doctors to a doctor that I love. He kind of walked us through the whole process. He was so patient. That round, I got 5 embryos. So we were over the moon again. We were like, hey, we doubled our numbers. I was a little bit older then. I think I started fertility treatments when I was 41. So my second round with my favorite doctor, I got 5 embryos, transferred all 5, didn't work. Then at that time, my husband and I were doing a long distance relationship. So he was here in San Francisco, I was in Hawaii. And at that time I was like, you know what, we need to be in the same city. So I moved over to San Francisco and I got a job for a company which offered fertility benefits. So I was great. You know, we tried one more time. And this time I got 12 embryos. I was 2 years older than the first time I started. So I was 43 at this time. And, you know, I transferred 5 the first round, didn't work. I waited about 6 months because I had surgery to remove some fibroids. So I needed to, you know, heal the scar tissue. And so in September, we started again. We, you know, started on medication, and then my dad passed away unexpectedly. So I told my husband, I don't know if I can do this. I'm so stressed out. You know, I was flying back to Hawaii, trying to, you know, take care of his affairs. And, you know, just the stress level being so high, I was like, I don't know if this is the best time to do it. But I had already started my medication, and you know how expensive the meds can be. So I said, you know what, let's just push through. It was November 17th. It was the day that he was going to the Philippines. We tested at home and we were pregnant. And so that is our daughter, Mila. She is now about 6 weeks old, the love of our lives. And, you know, that's kind of my journey. I just, you know, always want to share my journey because I feel like if I can be of support or encouragement to anyone going through the journey, I just want to be there for, you know, whoever wants to talk about it. Because when I started my journey, I didn't have anyone to talk to about this. So.
Thank you. And of course you made me cry, which probably isn't.
Sorry, I still have like postpartum hormones and I always cry when I talk about my miscarriage.
And I will be on, I too have had a miscarriage. And I think these are things that we don't talk about as women as things of being common. So I appreciate you, Emmy. And again, and that's why we love what we do, because we really are committed to making sure that we give the best patient experience and beyond, like more like the best human experience, and really treating people with love and empathy, and having that support is why we do what we do. I'd also like to introduce Nora. Nora is also coming from the Bay Area, and she has a journey to share with us. And then just so everyone knows, we're gonna just briefly talk about this, and then we're gonna have Dr. Westfall talk about the medical side of things and have conversation. And we will absolutely at the end go deeper. We're gonna ask more questions of each presenter. There's just so much stuff to talk about. So we're excited. Nora, please tell us. Welcome, welcome, Nora. Thank you for being here today.
Thank you for letting me join. And if I make it through this entire time without crying, it'll be a miracle as well. So we're all in it together. So I am on the verge of turning 49, which is horrifying, but whatever. I like to say that I've lived a long and varied life, and so I'll go through it pretty quickly. Divorced at 35. It was a very conscious uncoupling. We're still great friends. I had a 2-year relationship, thought I found, you know, the guy that I was going to have kids with, that imploded in spectacular fashion. And so I was then 38, and 3 months before age 40, I froze my eggs. And I only got 7. And I think we'll talk about this, but really one of my messages to all of you is it's a numbers game. You know, it really is a number. The number of your age, the number of your eggs, it's a numbers game. So I got 7 eggs. And then I moved to the Bay Area at the age of 40. And I got to the point where around about like 2014 to 2017, I thought, oh my God, the guy is not going to show up. Oh my God. I'm going to have to do this alone. So there's lots of therapy, lots of tears. I have a very supportive family. But anyway, finally at the age of, I have to look at my cheat sheet because I'm like, how old was I? I started at age 46 and froze my egg, or unthawed my eggs, and actually did get pregnant and miscarried at 2 months. That was pretty devastating. So at this point I'm 46, my eggs are gone. And so I used an egg donor and I got 2 embryos. The first embryo, I was pregnant for about a week, medical, you know, chemical pregnancy, as they call it. And then the third one is my son, Garrett. So I gave birth at age 47. He's now 16 months old. You can see some of his friends are hanging out behind me. And I just really, I think that probably most of you who are listening have on some level fear holding you back, fear of stigma, fear of what will people think. And by the way, the older you get, the less you care. Like I wish I felt like I do now when I was in my 30s, because I give zero shits what anybody thinks about me. But so you have fear of stigma, fear of like, can I do it? Fear of finances. And really, being on the other side, I hope that we can allay some of your fears today, because it's so good here. And the other message I have is if you want to be a mom, you will be. That's it, plain and simple, you will be. Mountains get moved. I made more while pregnant. I made the highest income of my entire life while pregnant. Like, it's just, there's something primal. You will make it happen. So anyway, that's my spiel for opening.
Welcome. And then speaking of finances, we're going to talk to Nicole. Can you wave, Nicole? I want to get started, but I want you to say hi. Nicole is from Future Family. I spoke a little bit about her yesterday, but we're going to go in to our wonderful partnership for financing to really talk through how to make things possible. And again, to Nora's point, is that everyone really deserves to have the family of their dreams, and we're here to support you however that looks like. So Dr. Westphal, thank you so much for taking time today and talking about this, but welcome, and we're excited to start the conversation. Oh, and actually, of course, it's my slides that need to be, okay. So for anybody, I apologize if you were here yesterday because there's a little bit of a repeat, but we wanna make sure that we share this again. So there'll be a couple moments of deja vu for you. But as I've said over and over, we're really here to make the fertility journey an inclusive and welcoming experience. And that's why we're here and what we do every single day, and really what gets us out of bed every day. From our CEO to our phlebotomist to our MAs, like it's just such an amazing group to be able to work and come together to help people have the family of their dreams. This is an overview of everything that we do at Kindbody. We have everything from fertility to gynecology. We also offer counseling and support. We have an amazing, we have online is virtual practitioners that can help everything from meditation to therapy and nutrition. So we're really just working to be a holistic and integrative medicine to support you every step of the way. Okay, and we're gonna get started. Dr. Westphal, here we go.
Great, so nice to be here with everyone. And those patient stories are so wonderful. And that's why Kindbody exists, because we want to help everyone have the family that they want. In order to have a child, there are 3 basic things that we need. So you need to have sperm, an egg, and a uterus. And depending on whether you have some or some of these building blocks will determine how you're able to have the family that you want. So we'll get into those different options now. Okay, next slide. So the very first thing is to come in for a consultation to discuss what the options are with the building block or building blocks that you have. So we'll talk to you about your fertility health and what your family building goals are. If you have a uterus and ovaries, then we will do an ultrasound and blood work to have some idea of what your ovarian function is like. If you have a partner who has sperm, we'll do, send you out to do a semen analysis. So just depending on where you are, will determine the best testing and options for you. Okay, next. So we focus a lot on egg quality, and that's come up, I think, in most of our conversations today. And I think everyone knows that nothing functions quite as well as we get older. So, right, joints don't work as well, heart, brain, everything starts to change with aging. And the ovaries know better than any other part of the body how old they are. We know that women are born with all the eggs they're ever going to have, and every month women lose hundreds up to 1,000 eggs every month. And as women are losing eggs, the quality is also declining. There's no great predictor for quality, so the best predictor that we have is just the age of the woman. And we know that when women are younger, the quality tends to be much better. As women get older, they are more likely to be chromosomally abnormal, and that causes a big decline in the quality. When we are trying to have an idea of what your ovarian reserve is, so kind of have an idea of how many eggs you may have left, we'll do an ultrasound and we'll look at all of the little resting follicles, so the little egg sacs that hopefully contain eggs. So we'll look at those. We'll do a hormone test called anti-Mullerian hormone, or AMH. And then with those numbers, we can tell you if your ovarian function looks good for your age, or maybe better than expected, or perhaps, you know, lower than we would like to see. So if the egg count is very low, or based on age, we think, you know, the egg quality is going to be very poor, or if, you know, it's a male couple where there isn't an egg, we need to select an egg donor. So there are a couple of different options for doing that. There are egg banks where you can get frozen eggs, or you can select a donor who's just donating for you. So you would get a fresh batch and get all the eggs that she's providing. If you go through an egg bank, it's going to be anonymous. Even for fresh eggs, if you're going through an agency, you can still be anonymous. Some people, though, have a friend or a family member and feel more comfortable using someone that they know. So there are a lot of different options, but at the end of the day, everyone ends up with the same screening. And I know, Nora, you went through the process of looking for an egg donor. Do you want to talk a little bit about how you looked at it and how you found your donor?
Sure, yeah. The clinic that I was working with had anonymous egg donors. They had frozen and fresh. And again, for me, it came down to cost. I was quoted, and again, this was 2 or 3 years ago, I was quoted that fresh eggs is $48,000. But they had a deal, you know, it's like the supermarket blue light special. They had a deal where if I used frozen eggs for $20,000, I could get 2 embryos. And so that's the route I went. You end up learning a lot about the women. And in a weird twist, because, you know, I don't want to be too like tutti frutti or hippie-esque, but some of these things that happen along the way, you're just like, is this really happening? So my clinic asks all of the women, rather than being a donor number like 13641, which is how it is in the sperm banks, they ask their women to pick a fake name. And so they were, you know, there was donor Corinne and donor Jessica. And the woman that I ended up choosing was donor Nora. I mean, what are the odds of that? I was like, who's punking me? Who is punking me? Because my name is actually very rare. And we are incredibly similar. And it's still very strange that people say that, that my son and I look alike. Because of course there's no actual genetics in play. But, you know, I like to think that maybe it's like, you know, dog owners and their dogs, they end up kind of growing to look alike. That's what I'm thinking is happening to me and my son. But anyway, but I feel wonderful. And I love my donors. Like, I'm in love with both of them, the sperm and the egg donor, because they gave life to the love of my life. And what a, you know, really selfless thing. And so I just, you know, I have a crush on both of them.
Yeah. Yeah, so there are many, many different ways to find a donor. Actually, one of my favorite stories was a patient who had been looking for a while for a donor. And then she was on a flight, and the flight attendant, you know, is coming by. This is pre-COVID, long time ago. And, you know, the flight attendant asked if she wanted anything. And she said, well, how about an egg? And the flight attendant, I think, was like, what? But they started talking, and the flight attendant you know, said that she was going to be a donor for other things. And so she became the donor for this patient, and it was just a lovely, lovely story. So people do find donors many different ways. The majority of people tend to go through an agency and usually have someone that's anonymous, but you know, there are people who will find their own donor too. Okay, next. So when trying to decide between fresh or frozen, the other thing that may factor in is how many children do you want. If you use a frozen donor, usually you'll get just a smaller batch of eggs. So typically it's about 6 that the agency or the frozen banks will give. If you think that you want to have multiple children, then you may want to get a fresh donor who donates all of the eggs that she has that cycle. And you know, a donor could have 15, 20 eggs in a cycle. So if you have a donor who's donating specifically to you, you may then, and you want more than one child, you may want to go that way. Also, if you are thinking about doing genetic testing on the eggs or the embryos, you may want to use a fresh donor also, just because you would probably want to have a bigger pool of eggs. So moving on to the test for men, typically we rely primarily on the semen analysis, and so you can see on the right the numbers that we expect to see, but there's a whole range between fertile and subfertile, and there are men with very, very low sperm counts who sometimes, you know, still are able to initiate a pregnancy. And then even if the sperm count looks normal, it doesn't always mean that the sperm are going to function normally. But this is the primary test that we start with. And we focus a lot on the age of the woman, but the age of the man does matter too. Men don't actually have a complete stop of producing sperm the way women do with, you know, once the eggs are gone, that's it. But over time, we do see a decrease in the semen quality. Also, because these sperm have multiplied so many times, they accumulate mutations. And that is why you do see some of these things increase in children of men who are older. So for example, older fathers are more likely to have a child with things on the psychiatric spectrum like bipolar disorder, schizophrenia, you know, so things that you can't test for prenatally, so things that usually aren't detected until after the child is, you know, usually at least a few years old. Next slide. Okay, so if you're going to use a sperm donor, just like with an egg donor, they can be anonymous or they can be directed. The majority of donors are anonymous through a sperm bank. It's just the simplest thing, and I think I can have both Nora and Whitney talk about this. So if you use an anonymous sperm donor, you know, you can look through catalogs, the sperm just gets shipped. If you use a directed donor, then the testing needs to be done at the fertility clinic, and it takes a little bit more time to get all of that done. So I don't know, Whitney, do you want to talk a little bit about how you went about finding your sperm donor?
Yeah, absolutely. So initially I had a very strong image of what I wanted in my head regarding donorship. I wanted to use a known donor that I knew personally. And for years, that was just kind of this narrative I had created in my head. When it got down to the nitty gritty and timelines of things, that quickly changed because I realized that, you know, the combination of kind of nailing someone down to a very small timeline, because as the doctor has gone over before, it's a very small timeline of conception of fertility. when you're trying to conceive, rather. So being able to nail that person down, that individual down to that 36-hour window per se was challenging in itself. Finding somebody that could emotionally detach themselves when it really came down to it was challenging as well. So for me, I started looking into using a sperm bank, which initially I hadn't really planned on because I really wanted to feel the energy of things. But as I looked into it, I realized that these sperm banks go so extensively into, you know, the donor's personalities. There's a very strict screening process. So I really felt like I could get a very solid sense of who these people were that were contributing. So when I did this, when I embarked on this, you know, I ended up finding somebody that I ended up just really resonating with on a humor level, on an interest level. It was important for me that they were an open donor because I want my child to be able to contact them if they ever have curiosity about their other genetic half. And I really appreciated the approach that the donor took on things when talking about being contacted. Also, and we can go into this a little more, I know
Sure.
I know Nora and I spoke on this privately before, the concept of, you know, a sibling pool, which I've come to learn the term through Nora of dibblings. Love that, this term. So it's donor siblings. And basically what that is you have access to a chat group of sorts that all of the offspring of this donor can access if they choose to. So it really kind of redefines family and extended family. And I thought that was something that was amazing and really important, especially for me in my circumstance where, you know, it's an unconventional family structure of sorts. And I, you know, especially being a queer woman, the concept of chosen family and extended family is really something that takes a big precedence in my life. So that I ended up going that route. Don't regret it at all. Feel very confident about it. Nora, how about you?
Well, I jokingly say that I was asking Lyft drivers if they wanted to be my donor. You know, like I was just ridiculous. And at the end of the day, I'm really glad, again, that I just went with an anonymous donor. Although I want to clarify, Whitney, when you say you connected with him on a sense of humor, you're not talking to him. It's just you're reading materials. They write essay after essay. I mean, the amount of writing these guys have to do, that's what you mean, right? You're on mute.
Yes, that's what I mean. I listened to his audio.
Yeah.
His audio really sold it for me. Yeah, you don't connect with them on a personal, there's no personal exchange, but you can really get a holistic sense of their personality from the writing and the audio and things like that.
Definitely. Yeah, so I did kind of something similar. I went to a sperm bank and I only looked at people who were willing to have contact with the child. And the guy that I ended up choosing, I got it down to like 5, and then my sister and I listened to and it's amazing what comes through in the voice. Like, you know, we played like 30 seconds of one guy and my sister looked at me and she goes, "He's a jerk." And I'm like, "Yeah, he is. Next." And so, but I really, my guy, and he's kind of funny because one of the reasons I picked him, well, he's ID. So when Garrett, my son, turns 18, if he's interested, he can go to the sperm bank and we will be given this man's full legal name and last known address. There's very few who are willing to go to that. So he is, I think, very special in that way. But one thing I just want to say real quickly, I'm a big proponent of freezing your eggs. And part of that, so I'm going to diverge a little bit. Part of that is that I think that we are all primordially, it's, you know, primal urge of us to create mini-me's, to have children with our own genetics. And so this kind of goes back to the egg donor thing, but like, you can't discount, like, women over a certain age, it is wonderful to use an egg donor, and like I would never regret it. But I scream it from the rooftops. You really should freeze your eggs if you're thinking about it, because that's going to give you the best chance at having that connection. So wanted to get that in there somewhere because it really is, you know, even though, you know, I had to kind of get used to the idea of the fact that my son won't have my genetics. You know, if we do a 23andMe, he won't register as being connected to me. That's fine now, but now that we know what we know, and you know, if I were in my 20s, I would freeze my eggs immediately. Run, don't walk. because I think it's really innately important to all of us. End of story.
Dr. Westfall, I know you're
Thank you for
unfortunately the busiest lady in show business.
Hi. Yeah, so I wanted to introduce everyone to our new physician in San Francisco. For some reason, we're having some difficulty or unmuted on her.
Hi everyone, I'm Dr. Fayouzi. Very nice to meet you. And I'm wishing you all, and I just want to let you guys know that I'm available anytime. You have any question, please feel free to contact me. I'm here to handhold you and make your dream come true.
Thank you.
Thank you, Dr. Freezy.
Okay. Yeah. Yeah, so we're left amazing team at all of our locations. And Dr. Fayouzi is so talented. Besides being a reproductive endocrinologist, so a fertility specialist, she also is board certified in medical genetics, so which is obviously a really important thing with a lot of our patients. Okay, so the next, after you have decided who is providing the egg and who's providing the sperm, so when you have the actual embryo, you need a place to put it. And there are different options of who's going to carry the pregnancy. So if you have a good uterus, you can carry it yourself. If you have a female partner, just carry hers.
Are we having some technical difficulty here, guys?
Yeah.
Okay, we're good now. I was gonna say we can take maybe if we take your video off, sometimes you can hear better. But let's see. Go ahead, Lynn, I'm sorry.
Oh, so next slide.
Okay, there you go.
Did you hear me?
Yep, we're good now. Thank you.
Okay. Okay. So one option is insemination, and obviously if you do insemination, the person is also providing the egg. So if you are a woman, or if you're a lesbian woman who is using sperm donor, you can either start by doing natural cycles, so you can just go with your own cycle, and when it looks like you're close to ovulating, the insemination is just a simple little procedure, not much more uncomfortable than a pap smear, or you can do that with medication.
I'm so sorry.
If insemination isn't an option.
No, I'm so sorry. I went forward and I did not intend to. What's my,
Okay.
because I want to make sure that we get to talk to Whitney about this. So I'm so sorry.
Okay.
I did not.
Oh, about the insemination?
Correct. When you were talking about IUI, so I apologize. All our viewers, let's blank your eyes that we're talking about IVF. Let's pretend that we are still on the insemination slide.
Yeah, so many people may start with insemination, and I think Whitney used her donor. Do you want to about what the insemination was like, Whitney?
Sure. The audio is a little choppy, I'm going to say, but I'm going to piece the words together and make something. Make it work. You guys can hear my audio clear, right? Okay, just want to make sure. Yes, so with IUI, you said talk about my IUI experience, right? Because it was every other word I was getting. Dr. Westfall.
Oh, yeah.
She said, right?
Sorry.
Yes, please, Whitney, please share your IUI experience. Yes.
So, so basically, just because I feel like a lot of people actually don't know what actually takes place. Some people get confused between ICI and IUI and IVF, all three different things. ICI is intracervical. That would be something like a home insemination that you could just, for lack of better words or gestures, kind of do a at-home turkey baster mode, right? IUI goes past the cervix into the uterus, which is what I did because I got, the sperm sent down to me from Seattle Sperm Bank, frozen. And prior to that, I decided to do, you can either do your cycle naturally, which is what I tried the first time around, or you can do it with the help of hormones. I ended up doing my second time around it with the assistance of hormones. So I took Clomid for a week, which was a pill. And then I took a trigger shot, which I injected into myself, which basically triggers your LH to surge. Now, this is what I was talking about in terms of what I did not know as a woman about my own fertility, which was that there's a very small window that you can actually conceive. It's about 36 hours. Am I right, Dr. Westphal? It's 36 hours we're talking here. Like it's fairly tight, at least for your prime time. So upon using the trigger shot, they go in, and now mind you, the whole time when you're going in, they're monitoring your follicles and how they're progressing and how they're growing to see, to assure that you will have the highest probability of conceiving if it's possible. So I went in the morning, I went in prior, they checked my follicles to see how they were growing. Everything looked good. I got my sperm, went in, and then they did the procedure. Super easy, took about 15 minutes total, mainly because I just had to lay on the table for a while. It's painless. It's a very long, thin tube that's put inside of you, amongst a beautiful scenery, as I talked about before. And then you just sit there and wait. And so it's a easy breezy procedure. Getting in there within the time frame is what's challenging. It's a very hurry up and wait, because once it's in there, then you have to sit with it for about 10 days until you can get your results to see if it took. Is Dr. Westphal still here? Did we lose her? Did we lose her? Tracy. Oh, you're on mute.
Sorry, guys. Of course, this is the technology. What is he called? Is Mercury in retrograde? Is this what we're gonna say? Technology is working us, but that's okay. We're industrious humans, and we're gonna keep powering on. Dr. Westphal, I see you. Did we lose her again? Okay, Dr. Westphal, can you hear us? Okay, but why can we not hear you? That's the odd question.
Oh,
okay.
Did you make her a host?
I did. And I did. Look at you, you're so professional now, Whitney. Now you're like a Zoom lady. You're a Zoom.
I'm a Zoom lady.
Yeah.
Mainly because I've had so many technological issues that I've had to, I know it all now.
I'm not sure why we can't hear you. Lynn, are you there? Dr. Westphal. Annie, are you okay? Are you okay, Annie? Are we here? Okay. I am so sorry, everyone. Bear with us. This is the fun of a real event. This shows that we're not canned, and this is all what really happens. Okay. Hina, my wonderful Hina, I know you're in chat. Are you here? Can we make you a co-host and get you, I'm looking for Hina now. Oh, let's see. I am so sorry, everyone. Okay, let's try. Could my palms be more sweaty and more nervous? I don't think so. Yeah. Okay,
Should we just jump into, talking about more of our stories?
So yeah, why don't we, while we're working on technology and getting this figured out, I agree with Nora. So Whitney, why don't you start to, talk about our questions, and something that I think is going to resonate with a lot of people that are considering it, and also the people that have gone through it, is you kind of start to figure out there is no perfect moment. There is no, you always think in your head that there's going to be this right, I'm going to have enough money, I'm going to have this partner. It's like there's all these things that we put in our way. And I'd love, Whitney, for you to talk a little bit about yours, and then we'll continue on with Nora and even and Emmy, because like Emmy literally was in a long distance relationship and was able to make a baby from Hawaii to San Francisco. So I think that when you talk about being able to move mountains, it's something, I guess it'd be volcanoes. We move volcanoes in Emmy's experience. But Whitney, tell us a little bit about you and how you, that aha moment of like, wait, I'm going to do this.
Right, sure. So, like she said, I feel like we have created benchmark timelines in our head, whether it be through kind of social conditioning, through the media, through families. And you think like, I'm going to wait until I find the perfect partner, until I'm married, until I have this much money in the bank. For me, I had all those. I knew I wanted to be a mother. I always knew that. And I had been married, I had been divorced, I had a solid career. I had all those things, and I started realizing that I had yet to embark on this journey. And like I said before, as a queer woman, it's not just something that's gonna fall into my lap. So I knew I had to take initiative on it myself. And you start realizing, the years are going by very rapidly. Nothing is stopping for you. So, I said to myself, like I touched on earlier, I said to myself, I'm getting into my 37th year. I know that I feel young, but it doesn't mean that my eggs are going to remain young forever. So I knew that when I got into my age 37, that regardless of anything, I was going to start this journey because it was clearly mine to make, regardless of if I had a partner or not. And there was also things that I faced, like being an androgynous identified or sometimes masculine of center identified woman. There was a lot of people that I faced kind of like, not raised eyebrow, but just shock, surprising that I wanted to tap into this area of myself and my body and do it on my own. But it was just something for me personally that I felt incredibly called to do. And that I knew that I at least needed to see where I was at with things, which is why getting fertility tested in itself is so important, just to set your baseline. And I'm really just so incredibly glad that I did it. I've had an amazing pregnancy so far. I'm super grateful that I'm here right now. And I'm 60 days and counting out from being a mom. And I'm really just grateful that I listened to myself and had enough faith in myself in the process, and faith in myself as a single woman to do this. And it can be difficult to navigate at times, but overall, it's just like, talk about no perfect time. Like, I never intended on having a global pandemic kick off right after finding out I was pregnant. So, they say there's no perfect time and you can't plan enough and this and that. But it's about just simply making the decision and having faith that everything else will fall into place. Nora said earlier about you kind of go into a primal mode. It's absolutely true, but it's also, you go into a very resourceful mode. Like I've just been pivoting. I've been pivoting in my career, in my relationships, in my personal safety within this pandemic. And I think it gives you a sense of preparedness to actually be a mom, because you're not going to know it all. I'm assuming. I'm not a mom yet, but I'm assuming you don't have a handbook handed out to you. So it's a good preparation, just having faith in yourself to be able to do it. So I would like to shift it over to Nora and hear about your experience too. What about your timeline? What was the moment that you said it's go time?
Well, as you know, it was one thing that I want to share with people. My favorite quote, and again, this is kind of hippy dippy, but my favorite quote is, leap and the net will appear. Leap and the net will appear. And, you know, I've lived a long and varied life. And the one thing at the age almost 49, looking back, the times that I've leapt, the net has appeared. It's amazing. But so it was a 9-year journey from when I, you know, froze my eggs to now, or to when I actually got pregnant and gave birth. For me, you know, and I've been thinking about it. My family was very supportive, even though my parents, you know, were much older. My oldest sister is 60, so I'm the youngest baby by a lot. And in April of 2017, so again, from 2014 to 2017, I was like, there's no guy, I'm gonna have to do this. Oh shit, is this what my life has become? Ah, I can't do this, you know, that kind of thing. And in April of 2017, my mom died, and we were surrounding her. I held her hand as she passed. And I just, watching her on her deathbed, surrounded by her children, it is still a very lonely moment that we will all face. And I thought to myself, if I'm on my deathbed, will I be okay with never having been a mom? Will that be okay? And the answer was F no, it will not be okay. And in that moment, I was like, I'm gonna do this. And there were tons of scary moments along the way. Like I said, there were 3, you know, I went through 3 rounds before I had my son. I will drain my 401k, knowing that what I know now, when his fat, chubby little arms hug me and he starts calling me mom. This week, he started calling me mama, like he gets it. Literally, there's no amount of money that should stop you. If you can think about that deathbed moment and your answer is, oh, hell no, I'm gonna be a mom, it'll work itself out. And you just have to really, there's a lot of trust. You have to leap and the net will appear. But my God, ladies, if you want to do it, you know, I can't even tell you how amazing it is. It's unlike anything else. And it's the one purchase you're not going to regret. It's not like, you know, oh shit, why did I spend $500 on a handbag? Now I'm, you know, adding up my debt. It's like a nice car, you know, it's like a really, really nice car. And I don't even, you know, screw a car. I've got a son who calls me mama and hugs me with his fat arms. Like, come on, get over the fear.
Yeah. Yeah. Thanks, Nora. Can you hear me now?
Yes.
Yes. Good. Okay. Yeah. So something that I hear over and over and over again, and many times from women who ended up meeting an egg donor, they always say the one regret was that they just didn't try sooner. You know, I've never had anyone who's had their baby and said anything other than, you know, I just wish I hadn't been so nervous and had just jumped in and done it. Absolutely. Okay, we'll go through IVF really, really quickly because of some little technical problems. So there are many reasons that people may need to do IVF, and sometimes people have failed insemination, they have tubal disease, poor sperm quality, older women, or genetic disease. And then if it's a couple with 2 women, sometimes one woman may want to have the eggs in the uterus of the partner. So there are many different options to having a family. Next slide. Okay, so IVF, basically, there's a little bit of preparation, but the active part is usually about 10 days. So you're doing injections that are just little needles that go under the skin. You're coming in every couple of days to see how the ovaries are responding. And then usually after about 10 days, it could be 9 days, could be 12, then usually the ovaries are ready to go ahead and do the egg retrieval. Next slide. So the egg retrieval is a pretty straightforward procedure. It looks a little bit scarier than it actually is. It takes about usually 10, 15, maybe 20 minutes if there are a lot of eggs to do. And you are heavily sedated. Usually the patient doesn't even remember being in the procedure room. And it's just a needle that goes through the top of the vagina, and then we go into the ovaries and take the eggs out of the ovaries. And then when the patient wakes up, there's nothing to see because it's just a needle inside the vagina. So then we have the eggs and the sperm, and there are a couple of ways to fertilize, either with conventional IVF where we put thousands of sperm around the egg, or this procedure that you see here called intracytoplasmic sperm injection, or ICSI. If you have frozen and thawed eggs, then that is the way that all frozen thawed eggs are fertilized. But if the sperm count is low or there's a genetic disease, then that technique is used too. And if you're going to do genetics testing, then that's done usually 5 to 6 days after fertilization. So the embryo is at a stage called the blastocyst, and we take a few cells from the part of the embryo that will form the placenta in the future. And whether to do genetic testing depends on a number of factors. If someone carries a disease for something like cystic fibrosis, then they may want to test specifically for that so they don't pass it on. The more common type of genetic testing is to look for chromosomal abnormalities, and we call that PGTA. And you can see on this graph that younger women most of the time will have normal embryos to transfer. So the chance of having a chromosomally abnormal embryo is much lower when women are young. And you can see that as women get older, the likelihood of having a chromosomally abnormal embryo increases greatly, and much less likely that there's going to be something normal to transfer. So then if it's time to consider transferring the embryo and you're using a surrogate, there are a number of requirements and things that we want for the surrogate. So they need to have been pregnant at least one time and have raised a child. They need to have had healthy pregnancies. And then we do limit how many past deliveries, so no more than 5 deliveries or 2 C-sections in the past. And they must be healthy and not use drugs or smoke or use alcohol. So the surrogate gets screened very thoroughly to make sure that they are healthy. We test the uterus. So this is a picture of what we call a saline sonogram, where we put fluid into the uterus to make sure it's normal before we transfer the embryo. And the surrogate also undergoes psychological evaluation just to make sure that there won't be any issues in the future related to that. And then the transfer itself, so whether you're transferring into a surrogate or into yourself or a partner, it's a pretty straightforward procedure. Just take a little catheter and then it goes into the uterus. You can see that little dot kind of next to where it says air bubble. And we just place the embryo a little bit from the top of the uterus. And then usually the embryo will sit there for a day or so and then start to attach. So
Dr.
basically,
I jokingly say that this is like a gymnastics person. You want it to like stick the landing. Like, come on, embryo, stick the landing. Get in there, dig in.
So most of the time the embryo will stay very close to where we place it. Occasionally embryos may move around. So that's why there's always a small chance of having an ectopic pregnancy where the embryo floats back into the fallopian tube. So whether you do IVF or you're transferring into a surrogate, there is a small chance that it could go back into the fallopian tube. So just to review, if you're going to use a surrogate, you need to make embryos, have an agency. Both the surrogate and the intended parents need to have their own legal representation. And then you want to make sure that all the psychological, medical, and legal aspects are taken care of, transfer, and then hopefully you have a healthy baby. Okay, so back to our wonderful panel.
Thank you, Dr. Westphal, and I'm sorry about the technological glitch, but I appreciate everyone for sticking with us. We're sticking our landing in this conversation. But again, Emmy, Nora, Whitney, you know, we talked a little bit about the idea of a perfect time And something else that you kind of go through is what sometimes I talk about fertility and I say that it's kind of like a mean game of chutes and ladders where you kind of go, yay, no, oh, like there's a whole up and down process of it. And Whitney, I'm going to start with you because I know, and blessed be that everyone here, oh my gosh, I sound like Handmaid's Tale, blessed be everyone that has a wonderful, delicious baby and one very soon on the way. Whitney, your first IUI was unsuccessful. So how did you kind of cope and strategize, and where did you go, like get to your next step to go forward? And then I'd love for you to, I'm handing the baton to you to kind of then ask Emmy and Nora as well.
Yeah, so, I didn't know how long it would take to do this process, but I did. Once I started, I had my first IUI with a different donor, actually. And when I did the process, it was unsuccessful. And, because I had never been pregnant before I started this journey, you have a natural sense of discouragement, right? Because you don't know, does this mean that it's the end of the line? Does this mean it's not possible? But I didn't allow myself to get into that headspace at all. I just kept going. I personally chose to not miss a beat and go right into the next treatment. I started and then that was the time when initially I chose to not use hormones to do a natural cycle. It didn't work. And then on the second one, I went right into a hormone treatment cycle, like I said, Clomid, just to increase the chances for myself, because I am older. I'm an older woman. I'm now 38. I guess that's considered older.
You're a baby.
I'm a baby, having a baby. But that over 35, they start saying that you are, your fertility, as Dr. Westphal was speaking on, declines. So, for me personally, it was about not losing hope, not getting discouraged as much as possible, staying in that positive mindset and just going right into it, just continuing on with my journey. And then the second one was successful, as you could see. So that's what worked for me personally. Just trying to keep a positive mindset and knowing that it is, like Tracy said, it's a game of chutes and ladders. It's ups and downs and highs and lows. And I know that Emmy went through several treatments and IVF treatments, and I know Nora went through things as well. Nora, do you want to speak on your situation?
Yeah, and then somebody said that they want to hear Emmy, so I'll get quick over to that. People are talking about the success rates, and I just want to tell a quick story before I answer Whitney's question. So when I froze my eggs, it was 2017. I was living in Toledo, Ohio, and the closest clinics that were freezing eggs were north in Detroit, and that's an 1.5 hour drive. So I called a bunch of clinics, I asked for their data, went up there, and I said, so you guys freeze eggs? Yeah, okay, I'll come up and see you. I sat down with 2 of the clinics and I said, so what's your live birth rate? Like, how many kids have you created from these frozen eggs? And they went, yeah, we don't really know how to thaw them. Seriously, in 2011, the egg freezing was considered by the FDA or whoever an experimental procedure. They didn't know how to thaw the damn eggs. And then when I actually found the doctor who did, I said, what's your live birth rate? 13 children. There were only 13 children he had created. So like the science has come so far. This is just, it's now standardized. Everybody knows how to do it and everybody's doing the same thing. It's really much more science than art. And I got lucky because my guy in Detroit, he was up on the science and he did it right. But so I just kind of want to allay everybody's fears about that. Also, another thing they tell you, like I started off being, doing yoga and like waking up and meditating with the sunrise and getting, drinking Chinese herbs and getting acupuncture. And finally for the last round, I was like, who is this person? I love drinking and I used to smoke. Like I'm not a get up and commune with the sunrise kind of person. So I really just like shed all of that and just went, all right, let's do this. And I just really kind of was like, I actually told everyone I don't want to talk about it. I'm going to pretend that it's not happening. And that's when the embryo stuck the landing. But a lot of that I think is the mental game that I got myself so hyped up. And when I finally just said, all right, this is my 3rd round. Am I going to do a 4th, 5th, and 6th? Yeah, I am. And that kind of let everything just flow away. All the anxiety just kind of flew away because I knew I was just going to keep at it until it worked. So that's another bit of advice I have for you guys. I mean, what do you think? Did you kind of have similar feelings?
So for me, it's been definitely a roller coaster. After the miscarriage, we were super discouraged, but then we were like, okay, fertility treatments, let's try it with the IUIs. I did 3 IUIs 3 months in a row. I think it was it was March, May, April, May. Those didn't work. And then I took a little bit of a break because we were kind of in that headspace where we were very discouraged after everything that we've gone through. But then we found out that my insurance in Hawaii covered a round of IVF. So we were like, okay, great. This is amazing news. You know, let's do it. And at that point, I wasn't as educated about the whole process as I am now. And I thought, okay, this is like one and done. I'm going to do the IVF. I'm going to get pregnant and, you know, we're going to have a baby. Not the case, right? So I think a lot of it had to do, also helped is, you know, educating yourself. I joined a few forums on Facebook, talking to other people going through it, you know, just getting more information kind of helped me through it. So after the first IVF didn't work, I was like, okay, what do we do? Let's try again. I quit my job at that time and I ended up getting another job so I could get coverage for another insurance company. So in Hawaii, it's one of the mandated states. So each insurance company offers one round of fertility treatment. So that kind of helped in the financial aspect for me. Then the second time the IVF failed, that was when I was really, really, really bummed out. I mean, my mom found me crying on the, you know, I was like crying on the bedroom floor because I was so upset. And, you know, at that point, my husband and I were married, but we were doing long distance. So then that's when we decided, okay, we need to be in the same city. I think the stress of being in a long distance relationship is probably has something to do with maybe why, you know, our treatments aren't working. So I made the decision to move back to San Francisco to be with him. And I think the reason why my third round, my results were so great, I think it was because I was less stressed. You know, we were in the same city, we were there for, you know, we got to go to the appointments together. This is pre-COVID, so we were, you know, able to go to appointments together in person. We were just there for each other, and I think that's really what helped with my results for the third retrieval and why I had such great results. And then, you know, my third transfer didn't work, and, you know, we really wanted a baby. So we, you know, picked up the pieces. I did my surgery and then, you know, we continued. And I also, like I said before, I almost gave up when my dad passed away. I mean, that was like high stress level. I was like, couldn't think about anything else, you know, but we decided, let's just do it. And I think it's just, I think it's a blessing for my dad, who's, you know, now not with us anymore. But yeah, I'm so glad that we did push through because, you know, now we have Mila and, you know, our dreams came true.
Thank you so much for sharing that. I mean,
I was just going to say to the two of you, doesn't it feel like we're on the other side, and everybody listening must feel like, oh my God, there's so many questions, and like, you know, I'm seeing like all the acronyms in the chat, and it just seems overwhelming. But like, you get through it, you educate yourself, you end up crumpled on the bedroom floor, you pick yourself back up. Like, this is tenacity. This is the long game, ladies. You got to like just dig in. And again, it goes to like, if you want it, you can have it. It might not be your own egg, but if you want it, you can have it.
And we've had that conversation too, where we were, you know, because of my age, and, you know, we had the conversation about, okay, should we consider egg donor? You know, we could use his sperm because, you know, he's fine. It's my eggs that were kind of the problem, I guess you would say. So we talked about that as well, you know, and we also talked about, okay, you know, should we try again? Should we go to a different clinic? What, you know, we've had all of those conversations. And, you know, at the end of the day, I'm just so glad that we didn't give up.
Yeah, I agree. There's the common theme that I hear between the two of you, as well as I know I share it myself, is just really deciding, making that decision, and sticking with it, and knowing that there are a bunch of different options, and different channels to explore, and there's not just one, and there is support out there. You know, that's another thing. There's support through different groups. There's support within the kind body community. So, you know, use it, you know, this is why we have amazing things like this to come on here to really answer the questions and show people that, you know, you're not alone, and you need to take that power back into yourself and gain the knowledge and gain the information to make your own best decision. And it's about creating kind of that structure for you, and that information system for you. And kind of leading into that, I really want to touch on, because I've had some people go into the chat here, asking more about different groups and things like that. And I can say, as a member, as somebody who's in the LGBTQ community, for me, kind of this concept of creating a family on my own, and restructuring the term of family has been something that is kind of built into the community with us. And I spoke about the whole dibblings thing before, you know, this concept of sperm donor and getting siblings through it and things like that. Nora shared she was the one that put me up on this term, which I love. I was aware of the sibling pool, but this term was really unique to me. And she told me a story I would love for you to share, Nora, about the Facebook group, and that whole concept of dibblings.
Yeah, I mean, we're in a brave new world. We really are. So my friend, like me, solo parent by choice, her daughter, I'm going to allow my son, when he turns 18, to register. It's called the Donor Sibling Registry. And it's kind of an honor system, of course, it's not mandated, but you'd like to be able to know that you're not dating your sibling, your half sibling. So that's part of it, is like, who's connected to who. And so I'm going to wait, but my friend couldn't stand it. She wanted to see, you know, how many half siblings her little girl had. She's got a 2-year-old. So she registered her, and lo and behold, there were like, and this was about a year ago, there were already 28 half siblings, all under the age of 2. And so these parents found each other, and they went off the donor network into Facebook and created a closed Facebook group, because they're all parents of half siblings. And she had another batch of eggs. She wanted to be a single mom twice over, which is amazing. That didn't work, and she lamented. She was aching, and she went to the Facebook group and said, "I'm so sad. It looks like my daughter isn't going to have a sibling." And one of the other families had leftover embryos, and they said, "You can have our leftover embryos." And so they arranged an embryo adoption. And so she's now trying to get pregnant with these half sibling donor embryos, which is just amazing. It blows your mind, you know, but like, thank God we're in this world. Just real quickly, my grandmother was a single woman at the age of 40 in 1933, in the middle of the Great Depression. She got knocked up by the guy down the street, hid her pregnancy from everyone, her family, her great paying job at the railroad, gave birth on a Friday, gave my dad to a foster family, and went back to work with nobody any of the wiser, because if they knew that she had had a child out of wedlock, they would have fired her for being a whore. Like, that was 1933. How incredibly blessed are we to live in the world that we live in right now? And what a badass my grandmother was, I have to say.
Yeah, seriously. Yeah, that is true. And how far we've come. I know that we're going over. I want to make sure that we get into the finances of things, because I know people have a lot of questions. But just to wrap things up from our side of things, Emmy and Nora, is there any final piece of advice, if you could tell your younger self about this process, about your own journeys, what would you say?
Emmy?
I wish I would have frozen my eggs in my 30s. I had planned to, and then life happened and I wasn't able to. But I wish that I did, because then I probably wouldn't have had to go through, you know, so many rounds of IVF and IUIs to get to where I am today. So for the people that are thinking about it, I mean, do it.
Amen. I say freeze your eggs immediately. One of the other things I talk about is like you see these celebrities who are giving birth at age 50. Secret, those aren't her eggs. They aren't. And nobody talks about it. Sorry to egg shame all the celebrities, but it's bullshit. They aren't your eggs. And now I'm part of the problem because I work with a bunch of young women and they're like, oh, I know somebody who had a baby at 47. They're not my eggs. So run, don't walk, and freeze your eggs. Nicole?
Yeah, and I would say for me personally, it's have faith in yourself, trust yourself that you are capable and strong enough to embark on the journey, whether or not you're in the seemingly perfect position, because there is no seemingly perfect position, right? You know, I'm single in a global pandemic and having to shift careers, and I'm doing just fine because I'm making it work, and I feel really good about my decision. So with that being said, I want to thank Emmy and Nora for being so candid with their own experience. I know that it's a very intimate one and very personal. So thank you for that. And I would love to shift things over to Nicole Fry, who's with Future Family, just to talk about finances, because I know that comes up a ton. People have a ton of questions about actual costs and how they can make it happen.
Sure.
Nicole,
Hi, everybody.
Sorry, I'm going to share your slide. So fingers crossed, technology gods work with me. But Nicole, you introduce yourself. And again, as I spoke about earlier, that we all, like, once you go through this, a lot of times you start working in the field, and Nicole has her beautiful babies through IVF. So once it happens, you're like, I'm going to change. I'm going to be part of this amazing network. So Nicole, as you introduce yourself, I'm going to attempt to get our slides up. So go ahead.
Thanks, Tracy. And thank you, everybody, for sharing your stories. As Tracy mentioned, I am the mom of two. My oldest is going to be 7 next Thursday. I did IVF for them. I think I skated by with the easiest cycle of IVF ever. My husband and I tried for 3 years unsuccessfully to have children. I was 32 when I did IVF. I did 1 round of IVF. I got 29 eggs. I had 18 embryos. I see these people glaring at me in the screen going, how do you get so lucky? But I will say nobody gets it all. I was incredibly young. I was not 35 yet when I went through IVF. And we had tried for 3 years unsuccessfully, no miscarriage, not a false pregnancy, not even a day late. So there I was, very young, sitting on the table as a fertility nurse, not recognizing that I was my own worst enemy and my biggest problem was myself in getting to the clinic and moving forward. And one of the biggest challenges that is presented for couples and singles and everybody moving forward with fertility treatments is the cost. And how are you going to sustain these costs? When you see the final price tag, people's jaws just hit the ground. When I worked in the clinic, people would literally beg, borrow, and steal. They would come in with cash, a credit card for $500, a check from Aunt Mary, and like another check from Uncle Joe. Like literally they would come in with 5+ means of payment to just pay for this IVF cycle. So I now work for Future Family, and we are a fintech company based out of the Bay Area, and we've partnered with Kindbody to offer fertility solutions to everybody going through going down their fertility treatment paths. So interestingly enough, our CEO and founder, Claire, also went through multiple rounds. She did 6 rounds of IVF for her 3 beautiful children. So we did a calculation this week, and approximately 40% of the Future Family team has either been an egg donor for somebody, a gestational carrier for someone, or undergone fertility treatments themselves. So not only do we know the business, but we've lived it as well. Big ticket cost items. These are what make most people's jaws hit the ground. So IUI, if it's non-medicated with just oral medications, you're looking anywhere from $1,250 to $1,400. Things that are to take into account when you're looking at demystifying these costs of IVF, because usually you'll see the procedure costs, right? You'll get egg freezing is $6,500. And then people forget to factor in that there's medication, there's lab work, there's storage fees, there's all sorts of other pieces that come into the equation. Not to mention, you might have these eggs on storage for a couple of years. So these are all things that are factored into your final ticket cost for an egg freezing, an IUI, or an IVF cycle, or even if you're embryo banking and you want to store those embryos long term. Typically, for egg freezing cycles and IVF cycles, your medication costs range anywhere between $3,000 to $6,000. If you're factoring in frozen embryo transfers, I've seen that cost upwards of $9,000. So medications is something, and I think it's one of the biggest hidden costs for everybody in there. Third party, Whitney used third party, Nora used third party. Third party is any third person coming in to help make this baby, or a second person if you're single mom by choosing. So third party, you've got donor sperm, donor eggs, and donor eggs fresh and frozen, just as Dr. Westphal spoke about earlier. Donor sperm, the cost is anywhere, donor sperm 100 years ago used to be like $100 a vial, and recently it's shot up incredibly in price. And the number one reason, and I've seen some of these questions coming through in the queue, is genetic testing. Like, why is sperm expensive? They do such an extensive health history, genetic screening, and everything on all of these donors, which is why you start to see the prices go up. These prices that you see up top, the total cost, will be in addition to your IUI or your IVF cycles. So you can take that and factor it in. If you guys want to know really quickly baseline prices, I did a calculation for some of the kind body prices. So an average egg freezing package with kind body works out to be approximately $132 a month at 7.99% financed over 5 years. An IVF cycle is approximately $250, again at 7.99% over 5 years. And then medications, $3,000 is probably about an additional $60, and $6,000 of meds is about an additional $120 monthly cost when factored in. So the whole goal of Future Family is to make it attainable for people to achieve their goal of having a family. Not everybody has, $20,000 in savings. Not everybody has an Uncle Bob who's willing to pitch in, or a family who's willing to pitch in. So really, Future Family is there to help you make packages that work for you on a monthly basis. We can compile everything for you guys and just make it really simple to minimize your stress and help you move forward with creating the family of your dreams. So if you have any questions, feel free to reach out to me at any time. I'm available. And we are here to help you guys get going. So thank you so much for having us at the call today.
Thank you, Nicole. And in earnest, a few things for you guys. Definitely look out there at what the other prices are. And in the first slide, I talked about where our goal is to have inclusive healthcare that's accessible. And our pricing, feel free, if any other fertility clinic, if you call them and they're not open with their pricing, that's a warning flag for sure. And something beautiful, as someone who has worked in this industry, been in this industry, and even when I had the first conversation with Nicole, as she's been in this industry, I said, when you walk into a kind body clinic, in a frame, a gold frame on our counter, our welcome desk is all the prices. And our prices are also your cycle. So there is no hidden ultrasounds, blood work. It's all contained within a package, so that you don't have that, and that you're able to really look at it as an inclusive price that has everything in there, and you're not worried that there's going to be an additional, because every single person is different in that you may need a different ultrasound, you may need to whatever, but that's all part of our packages. And I'm not saying that as trying to be salesy, but to be really honest and call other fertility centers, ask them what their pricing is. Is it inclusive of all the blood work? There's pre-testing, po-testing, like there's a lot of ways that other centers can nickel and dime you. And you really want, as we talk about, finance is a factor, and we need to really be honest at what those costs look like. Can
I just say something as a not person that works? I just want to hop in and say, as a client that came in, it was incredibly refreshing to see the transparency, and it was so clearly broken down that I was expecting things to jump out, unexpected costs, and it never happened. Also, everything is, along with the costs being broken down and so clearly laid out, kind Kindbody has an app, a portal app that really keeps track of every single thing. It shows you videos. It keeps all of your information in one system. So along with the cost being so streamlined, they have really nailed down a really easy system to kind of follow throughout the whole process. That's very visual and it's all in one place. And that's just something else I wanted to throw in there that I really appreciated on a very high level.
And, you know, I think I get so crammed in of saying all the other things, and it definitely is something I'm excited about. You can book online, and I'm going to tell you there is not one other fertility center that you can book appointments online, which sounds really silly because we're so able to, like, at a click of a button, spend hundreds of dollars. Like if my husband sees one more Amazon box on our front doorstep, because I'm, you know, clicking away, but I kind of take it for granted. And that we all know how busy you are. When I tried to make my own medical appointment for something, I was 3 different phone calls. I got hung up. Then it was different stuff. It's like it's really about trying to think about your patient experience at every angle. And it's really important to have something that's intuitive and supportive and have a portal that is easy to access and use. So because you've attended, you've had to endure our technological issues, we really want to offer you some wonderful discounts. So these are valid through the end of August. Normally we do these for just a few days, but we really wanted to make sure that we're offering, giving an offer that was accessible to everyone. Is that we're offering off the consultation, off an IUI, and then off cycles is $1,000 off of each cycle. And I would beg you to call any other center to find out if there is never a $5,500 price point. And again, why we get up every day is to be able to offer this and make this accessible. I think, oh, and we do accept insurance 100%. So we work with all the major carriers. Something that you really need to do is call your carrier, because you may have this insurance, but you may or may not have fertility benefits. So you want to call, and then if you do have fertility benefits, you want to ask them deeper. Is it just diagnostics? What is their definition of infertility? So you really have to empower yourself. And it is, when you have this benefit, it is your right to be able to ask all these questions and empower yourself as much as you can. But again, you can also email us at navigator@kindbody. If you're coming up, you want to know what questions you need to ask. If you're looking for any additional answers, we're happy to help. And these are our locations. Here we are coming soon. And I just want to say to everyone, thank you so much for bearing with us. I know we ran a little long, but I think it's so important to share all of these stories. I'm going to do my best to save the chat so that I can go back in. If there's any, again, if you have a question that you want answered that was not answered today, we would love to hear, what other events would you like us to do? We definitely want to do one for PCOS. We really want to, you know, as there's so much content, we'd love to be able to hone in and have the conversation. And so please feel free to message us. Let us know what types of events you're interested in seeing. We're upcoming going to have some support groups to be started. So again, every day we're trying to be better and be able to connect with our community. And the only way that we learn is to hear from you. A huge, huge thank you to everyone that participated, everyone that came today. I see a lot of faces from yesterday, so I appreciate that you stuck with us for 2 days. And I really want to say thank you to my panelists, because without you, that information, that information is so important to be shared with everyone. And so I thank you for being open and honest and vulnerable. Emmy, thank you for making me cry, as always. Yeah. And Whitney, I am obsessed with you because you really have been such an incredible partner and spokesperson, and really have done your very best to sing from the mountaintops. And I appreciate you so very much.
Thank you. I appreciate you too. I honestly, Kindbody has been such a blessing in my life. I mean, you guys are like family to me now. I really appreciate all of you. So thank you for allowing me the platform to spread the message, because I'm here. If people want to reach out to me personally too, I'm very accessible. I try to make myself as accessible as possible to answer questions, because we're all in this together in a sense, guys.
Absolutely. Dr. Westfall, do you have any last comments you'd like to add? And thank you so much. I know you're very busy and I appreciate you being with us today. We have, oh no, are we almost there? And then before we take off, I would like for the future, because we're always in, I really want to introduce Bernadette, who is just going through her egg freezing cycle right now. And I wanted to have her say hello. And she's sharing her journey with us on her platform on Instagram, Petite and Tone. She's sharing with us on Our Kind Body. And then we'll also look forward to be tortured with us in technology land, Bernadette. So welcome.
Hi, hi everyone. I do see some familiar faces. I just love the community. It's so welcoming. I came in so scared, like a week ago, even over a week ago, when I went into my first my first consult or assessment a month ago. I was just so scared, but you walk into the doors and it's so welcoming. You actually want to live there. And just, they make, like, I was so scared of the shots. They're so easy. Like, it stings a little, but it's not the worst thing. But yeah, it's so empowering. I just love the community of women here. I'm so inspired by everyone. I'm so glad that people are starting to talk about it and people are inspired to think about these things, start planning for themselves. So a week ago, I was like a hot mess. And now I'm so, like, I feel so confident about the process. And I wish I did this sooner. I wish Kind Body was available sooner. It was just so expensive through other paths. But I do think that Kind Body is, at least, you guys are very upfront about the costs, which I appreciate. And it's not that everyone can afford this, unfortunately, but it's just way more affordable and such a pleasant process compared to other places where it just felt sterile and cold. So I'm super excited to share my journey with you guys. Thank you.
Thank you, Bernadette. And I want to say a huge thank you to my amazing team that handled the chat. Hina, Lisa, like everyone, and Rebecca, my cohort in New York. I really thank you, because I know, again, we do our best to answer all the questions. And to be honest, we love it because we get to actually be with the people that we do what we want to do every day. So thank you to my entire team and everyone. And I hope everyone we're almost to Friday, so I hope you have a wonderful weekend upcoming. And again, Nora, Emmy, thank you so much. And Nicole and Dr. Westfall and every single person that attended today. So thank you and have a beautiful rest of your day. And Bernadette, I look forward to more and learning more about your journey. So thank you so much, everyone. Have a great rest of your day.